Welcome to the instructional video of how to fit the HeadUp Collar from TaylorMade. All of the components required to supply the HeadUp Collar to your patient are included within the pack. You will, however, need a heat gun, as many of the components within the collar are best heat molded. The fabric component of the HeadUp Collar, the snood section, requires some gentle heat prior to molding. This allows this component to be custom molded around the anatomy of your patient's neck and chest. Firstly, the fabric component, or the HeadUp snood section, needs to be applied to your patient. This is done while the brace has been warmed, and it is essential this is put on centrally. The HeadUp snood can be trimmed as required in order to ensure an intimate customised fit. For the purposes of this video, the reinforcing struts for the HeadUp collar have been painted silver so we can clearly see them against the black fabric snood. Reinforcing struts require heat moulding in order to ensure they appropriately fit your patient. This can be done with a hairdryer or with a heat gun on a low setting. Using a heat gun on low, the front section of the A-frame is heated in order to allow this to conform to the patient's head and neck. Once at the correct temperature, the A-frame can be taken and bent in the clinician's hands before application to your patient. The collar should be applied so that the chin component is flat and level with the chin, with the rest of the A-frame section positioned across the chest in a position like this. In this position, your patient should be able to move their head side to side comfortably and should not feel the chin component digging in. Once heated, the A-frame can be bent slightly at the top in order to create some shape to conform to the shape of the chin, and then be bent and tensioned whilst being applied to the patient. The struts fit with a microgrip fixation, and this should be contoured in order to achieve the required amount of correction. The struts can be removed and reapplied as many times as necessary. The A-frame is designed to sit at the front of the HeadUp collar and to directly support the chin for patients who suffer from head drop. The A-frame has been designed to provide supports to your patient without putting any pressure on the front of the throat. On application of the A-frame, if your patient's head is continuing to fall with the 2mm strut in place, we recommend using the stronger 3mm strut, which will again need heat moulding in order to ensure it is an appropriate and comfortable fit. The A-frame is the most frequently used component within the HeadUp collar. However, additional struts can be used in different locations in order to provide more support to your patient. We will demonstrate these now. Additional support can be applied by using the Z struts. These are applied to the side of the jaw and are bent and shaped after heating in order to provide some side support. These can assist in lifting the head whilst also limit rotation and side flexion. The A-frame can be used with both Z struts in order to maximise the amount of head control and lift. Once set up, the collar can be placed underneath the patient's clothing to improve cosmesis. The HeadUp collar should be fitted by a medical professional. The medical professional will use their clinical skills and judgment in order to ensure that the collar is set up correct on the patient. The configuration of the collar can be changed during the day depending upon activity and the degree of support required. Please ensure you retain any additional unused struts after fitting. These may be required for you to reconfigure the brace if their condition changes as time progresses.